showing us how both the mixture of improving using of technology to increase efficiency and our own preventative behaviors, us as individuals, what we can do to prevent a lot of these diseases. But combining that efficiency in our own behaviors can really help to save lives. So thank you for those examples. And he will be here later, just like the other panelists, so there'll be a lot of opportunities to continue this conversation. Are we ready for Tausi? Is the video ready? Okay, okay. That will be last but not least. So next, let's maybe shift gears a little bit and hear what some of the women's organizations here in the diaspora have been doing. And I'd like to welcome our very own here in North Carolina, Auntie Matilda, who will be speaking to us about UWT-NC.
Hello, everyone. Her Excellency, all invited guests, delegates, and everyone. My name is Matilda. I'm a North Carolinian local member, and fortunately, I'm the chairperson. I was the chairperson for the Women United here in North Carolina, and we're doing good. In every organization or in everywhere people live, there are some unions, small unions within the big unions. So the women in North Carolina, we decided, and so it was a good thing to have a small or our own unity that will bind us together, keep us warm, and understand each other better in case of emergencies, in emotion situations, in happiness, and we have been doing a lot good. We found ourselves that we were meeting in wherever we meet, in situations. Maybe we're not as close enough. You couldn't have a lot of dialogue with each other whenever you are sitting around. But, you know, we just go in, do whatever brought us there, and go home. But again, as we initiated and started this union, UWT-NC, which we call Umoja wa Wanawake Waishio North Carolina, we have found ourselves being so close together by supporting each other in different situations, in small businesses, and releasing our stress a lot by educating ourselves, being good mothers, good sister in the family, and planning activities that help us release stress as we find ourselves work a lot, and sometimes it's very stressful. So we plan and implement some activities, tea parties, beach trips, visiting each other, and just to have dialogues, to exchange ideas and support each other, educate each other about family issues every time there are some issues. And we found ourselves helping us a lot. So as diasporas, I encourage you, whenever you are, to establish something like this. We have logistics and rules that we have to follow to keep us strong and keep moving. It has to cost you to get in this union. You have to pay admission fee or registration fee. You have to pay dues. It's a little bit, but it's a commitment that will bind you and keep us moving, because the same cycle, your contribution is going to support you sometimes of emergency when you need us. And you will find people around you all the time. You're not going to stay by yourself, because we are too far away from home, where you have your own family a lot to support you whenever things happen to you. So I encourage you to establish something like this, because it's very helpful. And some of the of our members are here, some of right now. If you can stand up so they can identify you. Whoever is here, Joyce, please, you can stand up. And our chair lady this time is gonna be, is Zainab Black. She's the one taking over from me. And for your information, we're now about 6 years old since we established this. Thank you very much for listening. And if you have any question and ideas, we can talk to you about it. Asante sana.
Thank you so much. These women's organizations are so important, not only about empowering women in the areas of business and entrepreneurship, but as those of us who live in the diaspora know, as women and mothers, we have to go to work, some with 2 jobs, sometimes 3, but you're also the cook. Wewe ndio unapika, unafanya shopping, unafanya laundry, wewe ndio dada wa watoto. So this organization really is a place for women, in addition to all the other things, to exhale. Asante sana, Auntie. And another women's organization from Washington, D.C., Tano Ladies, karibu dada Asha Nyang'ani.
Kina mama oye! Oye! Should I say in Swahili? Is there any Swahili challenging? Oh. Kina baba oye! Good afternoon, ladies and gentlemen. My name is Asha Nyang'ani from Maryland. Today I'll be talking about not specific on the organization, but actually what we do as women in diaspora. When people hear about empowerment, they think it's something so huge as it sounds, but actually it's something very simple. Anybody can do it. And it's simple as sharing information. As one of the presenters yesterday, Dr. Daniel Sembua, did I say it right? Said yesterday, Tanzanians were very good in hosting each other, giving drinks, getting drunk, but we don't give information of how to survive. So it's 5 of us. We live in Maryland. We thought it's a time for us to start something for us as women. Just break the silence of being individuals. So the take-home message here, just remember a bridge. Build a bridge between you and your sister within the same house, same state, then cross the border, go to another state, then go all the way to Tanzania. And I'm so happy to stand here with all these women in this room. I know almost like 80% of women in here, just because we connected together. Women from North Carolina, would you please stand up, please? I'd like to really recognize you all. They drive, every time you call them for anything, they will drive 5 hours, come and support us. So the first time we had events where we had more than 200 women in one room. First of all, we thought it was a joke, but when it happened, it was a bomb, I'm telling you. It was a night of sister-to-sister talk, and of course, we have our mothers. Some of mothers are not here, so there's some women recognized mothers. They were there to trash us, you know, mothers. They opened up, they told us the truth, and it was a nice evening. From there, we network, we kind of know each other, discuss what we do, professional. So within our community, we have registered nurses, doctors, accountants, you name it, we have it. And we didn't know all these years. Then we thought it would be better for us to bring entrepreneurs. We have women who does something, either designing clothes or have catering business. So we organized the first event, International Women's Day, last year. And we tried to call friends, say, do you know anybody does anything? So we got few of them, but they were very effective. We had designers from here, North Carolina. I can proudly say Nashona was one of them. And Dada Flora, Dida Carter, and we had several others from other states. So we met in one room, one night, and they all had time to share what they do. And it was amazing to know we had all that talent within our own diaspora, and we didn't know about it. From there, they start partnering themselves based on what they do. So now we see, I can proudly say, we see some of women working together, doing fashion designing together, or when we have events, we know who to call to cook good food for us, or do fashion show, things like that. So what I'm giving you, I'm asking you as women in diaspora, try to build that bridge among ourselves. And we didn't stop there. We keep on making ourselves available to the federal level, to the state level, that, hey, we are here, women from Tanzania. We want to know what is in your office you can benefit from. So we started engaging with State Department, Governor's Office in Maryland, and we had a very good meetings and get involved with other programs going on. And, oh my God, 7 minutes is not enough. Anyway, I'm trying my best. And the last one is about health. Just reminding ourselves that we as women, we always forget ourselves. We take care of our children, our spouses, but we forget that we need to take care of ourselves too. So when we meet, we try to remind ourselves, hey, you need to check your tatas and your titties, make sure they're okay. So we have very good network of health services, and I'll probably like to recognize Ms. Shangarai, a registered nurse. She has a very good organization known as Nesi Wangu. You can go there and find information, health information in Swahili. So share with your families back home. It's very informative on any health issues. She organized the first free medical health drive in Maryland, where we had I believe 2 doctors from Tanzania, or 1 doctor from Tanzania, and 5 nurses from Tanzania who lives in Maryland. We all met in one room. People were given information about health information. Also, another thing, the Rosemary, my God, this woman here, we WhatsApp with her 24/7. We want to know what can we do as diaspora, and she give us a lot of good feedback. You need to do this, we can help on this and that. So we are still working on it. We didn't let you down. And we were able to secure a mammogram machine last, I believe most people have read about it. This is through organization. The same thing, you meet a woman from Africa, you ask what you do. Oh, I help women with breast cancer. And I'm like, oh, we have survivors in my community. What can you do? And she said, oh, I'll do for mammogram, free mammogram. So we invited this lady in our community. Now we are taking all the ladies from Tanzania who lives in Maryland, Virginia, and DC. They have that access to get free mammogram checkup. She gave us free mammogram, where we gave it to, we're lucky that the first lady was here, Mama Salma Kikwete, who is the advocate of breast in Tanzania. We hand over the machine, and it's on its way to Tanzania. Hopefully by the end of this year, it's going to be there, and we believe we will save some, a couple of women's lives. Okay, the last thing. So just remember, bridge, build that bridge. Let's build it, and we can do it. Thank you very much.
Asante sana, kina mama oye. And behind every successful woman is, yes, kwa hiyo kina baba, asanteni support. Thank you so much. Yeah.
Everything would be possible without our mama. She has been a big support. Anytime we call her, she will be ready to listen to us, support us. Thank you, Mama Balozi.
I am not surprised. I am not surprised, Mama Balozi. I'm not surprised because we experienced that throughout at the national level too. Thank you for those wonderful examples, Dada Asha, of building bridges not only within our diaspora communities, but crossing states and collaborating together. That is just so beautiful. Even yesterday during the fashion show, we noticed that when there was the models for Ms. Temeke and also Nashona, that they were the same models, and even though the designers are in 2 different states, because of that collaboration you were talking about. So thank you. Next, because this was not pre-planned, but I did agree to invite 90 for Life. We're going to have just 3 minutes because there isn't that much time left. And I'm sorry, oh, there we go. Let me introduce your names. So it's actually going to be a duo show here. I'm going to have Angela Clinpatrick and Lara Flint who are going to share 3 minutes together. Welcome.
I am so excited to be here. I'm Lara Flint, and this is my friend Angela. We're from the Washington, D.C. area as well. I'm here with my friends Angela and Bruno, who are both from Tanzania, and I am so grateful to be here, meeting so many of you and learning a little bit more about them, about their culture, and I would love to go all the way to Tanzania with my 5-year-old son one day, and that is a goal that I have. But I'm hearing a lot here about the importance of education and supporting, and that's what we're here about. I'm here to tell you about a man named Dr. Wallach, and he is a pioneer. He's a researcher, a biomedical researcher who's been doing this for 45 years. And he wrote a book called Dead Doctors Don't Lie. It's a health lecture. This has sold over 200 million copies. It's the most popular health lecture in the world. And he has an interesting background. He was a veterinarian. He grew up on a farm. First, let me go back to that. He grew up on a farm, and he saw his father feeding the animals. And he gave them a lot of nutrition, and he always thought that was really interesting, that they didn't take as much nutrition or vitamins as the animals did. And then he became a veterinarian, and he learned, and he worked a lot with exotic animals and farm animals, and he worked with reducing the risk of illness in animals. And they did that through nutrition. And he learned that you could reduce there are nutritional deficiencies, diseases that could be eliminated if you give proper nutrition. So they have animal feed, they have elephant pellets, and they have goat pellets, and they had all different types of pellets when they had all of this nutrition for the animals, and they got rid of these diseases. He saved many exotic animals as well. So he started to think, well, why don't we do this with humans? And so he became a physician. He became trained as a physician, and then he started to apply the research to animals, and he found that across species, that if you have he found that across species, minerals and nutrition are the currency of life. And if you have the proper nutrition, then the body can heal itself. The body is designed to heal itself by God, and it can do what it needs to do. It can maintain itself and it can heal itself if it has what it needs. So he developed these products that can do that. And he's got 2 claims. You probably know how difficult it is to get a health claim through the FDA, but there are 2 health claims. One is that are authorized so far, because he's constantly working on this. But one is about reducing the risk of certain cancers by consuming the trace mineral selenium, and who would ever even know that that was important? And also reducing the risks of cardiovascular heart disease by consuming essential oils, which are primarily the fish oils, and that's something that we were just talking about, was just mentioned, but I'm wrapping up in 30 seconds. We want to share this message. We are all about health. We're about the body, empowering the body to heal itself. He believes that so many diseases are nutritionally based. 900 different diseases are based in nutritional deficiencies. And women, if they are given all the proper nutrition, it reduces the risks of birth defects and all kinds of issues like that with their children. So we thank you so much for listening, and please come and talk to us more. We'd love to partner with you. And thank you so much. Asante-san, is that right?
It's my honor to be here, and I'm truly, truly grateful. All I ask is, let's be open. We're all here for one. I believe through this whole experience, this group is the most important, because this group focuses on the core issue of human life. We can have all the money, all the material, but if we do not have good health, healthy mothers, healthy children, what kind of a society are we? Therefore, with our product, I'm hoping that we can take it to my country and other countries as well. So let's be open, let's be responsible for our health. We take responsibility for our health, what we feed our children, what we put in our bodies. Sometimes advance is awesome. However, advance also, we need to look at what we put in our bodies, what we give to our children. So I thank you, and I'm truly honored. Thank you.
Thank you so much, 90 for Life, for that passion about us taking care of our bodies. Our bodies are our temples, women, men, and children. So thank you for that reminder and about your products.
Good afternoon, ladies and gentlemen. Good afternoon, Her Excellency Ambassador. I'm very honored to be part of the Dakota Convention to present and to wrap up this panel of great presenters. Thank you for the statistics. Thank you for everything, because you just made my presentation a whole lot easier. So I am Tausi Swedi, the co-founder of Childbirth Survival International, which is a nonprofit organization headquartered in Baltimore, Maryland, and it has an office in Tanzania. Now, for purposes of this presentation, I'm just going to talk of our work in Tanzania, even though we do work here in the U.S. and also in some other areas. CSI, also known as Childbirth Survival International. Oh, I went so fast. Okay, so I already said that part. CSI focuses to improve health services in marginalized communities around the world. I show you this map because these are the areas where you have high maternal, newborn, and child mortality. Of course, different countries having worse health statistics compared to the others. CSI vision is to grow into a reputable and trusted global organization in the elimination of preventable maternal, newborn, infant, child, and adolescent disability and death. The key word here is preventable, because a majority of these deaths that occur in Tanzania are preventable. Mothers get pregnant, they go to health facilities, they deliver, after delivery, they die. And the reasons of death could be like excess bleeding after birth, it could be an infection, things that are easily preventable. So CSI works to reduce the number of preventable deaths. These are the CSI priorities. We work with pregnant women, we work with newborns, we work with children 0 to 5, improving child survival, and also working with adolescents. This was this year, CSI went to Amana Hospital, and of course, there's no one-man show. CSI works with community members, it works with women, it works with regional officers, with the government as well, with the Ministry of Health. So CSI went to Amana Hospital and provided free childbirth kits, because many women don't go to deliver at health facilities because of the barrier of not having medical supplies, gloves, and all these other things that they need. So CSI went out there and distributed these kits for free. We also gave out life-saving medicines such as oxytocin, which helps prevent excess bleeding after birth. CSI at international events. We want to be seen, we want to be heard, because we are the voice of very many women and children and also adolescents. Our country director was out for the International Day of the Midwife. She herself is a veteran registered nurse midwife. You might know her, Mrs. Stella Mpanda. Very well known, you know her, okay, there you go. Very well known, so she's the country director for CSI in Tanzania. We also visit orphanages, even though it's not it's not a specific priority, but we recognize children in orphanages are just as vulnerable as any other child. So we do have extra activities where we reach out to orphanages and donate clothes, food, or pretty much find out what their needs are and are able to help them in whatever way we can. This was the most exciting one, reaching out to adolescent girls and talking about menstruation. Of course, as you can imagine, all of them were like, what? First, we also went with pads. We gave them pads as well. And of course, it was a very enlightening event, because talking about, wanaita kuvunja ungo, right? Right. It's not something that is spoken about every day. It's not talking about like food and fashion. So many girls get into this phase in their life and they have no idea what it is. And it has also contributed to high school dropout rates. Many girls don't go to school because of this. Many girls don't know how to take care of themselves. Some use papers, some use cloth, some use things that you would not even imagine. So CSI reaches out to adolescents, especially the girl child, to empower her with educational materials. And we also have interactive Q&A sessions. And you can connect with CSI on Facebook, YouTube. I mean, you can see our videos. We have interviews with mothers who've delivered at health facilities, and pretty much the work that we do in Tanzania. Making a difference, collaboration, saving lives. Asha talked about building a bridge. CSI takes that bridge and takes it all the way to Tanzania, to Uganda, to Afghanistan, and all these places, because women are dying, and the causes of death are very, very preventable. Something as easy as a midwife washing her hands. Very simple. Asanteni sana. Of course, like I said, it's not a one-man show. We all need support. We need your help. You can contribute in various ways, and you can learn more of that on our website. And I want to show you something.
Thank you so much, Tausi. Now we're going to put a video of childbirth survivors. Thank you for, that good example of not only taking care of mothers in terms of birth and ensuring that the health of the babies being born is saved, that their lives are saved and they're healthy, but also for the babies and the teenagers as well, and taking care of their health throughout that lifespan. So. Thank you so much. We'll take a couple of questions, and then we will introduce another doctor as well. Or why don't we do that real quick? Just if you can introduce, yeah, just an introduction. I'm sorry there's not going to be time for a presentation or of any kind.
I just wanted to welcome you here this weekend. It's wonderful to have you. And I want you to know that we have a great Arusha committee here that partners with the Arusha committee, the Friends of Arusha in Arusha, Tanzania. We've been partnered since 1991, and we are still working, and we actually have a lot of interest in health, and we're trying to help the Friends of Arusha build and furnish a clinic for an area. What's it? Daraj-Mbili. So we're in the process of working with you. It's wonderful to see how much is going on. It's such a helpful thing. Thank you so much.
Thank you.
You're welcome.
Questions. We can take maybe two. I don't.
Mine is not so much of a question, it's a compliment. I remember yesterday Balozi said, Rosemary, you were telling us about Cambodia, but you always come back to America. I am really, really, really amazed, and through the Ministry of Foreign Affairs, I'm available 24/7. I work with Asha, and I'm a person who says, if something it works, it works. If it doesn't, I won't beat around the bush. But I'm very much impressed with the Jenga project. It's very important for what you do, you communicate to us so that we know, because there's a similar project in China, Guangzhou, Mr. John Waimbuza, who is actually looking into putting the syllabus in a tablet made in China. And we are trying to connect him to a local service provider, internet service provider, Tigo, so that, and have them at a very, very low price. Instead of parents buying books, they buy them tablets, so that every child can have access to books available to the Tanzanian syllabus. So it's very, very important when you're having any initiative here in America, just drop an email, a WhatsApp. Me and my staff will try and see what we can do because we are paid for that. It is my job. And you know what I've heard here? It has given me more and more energy on working on diaspora. I was joking to people when it's 5 o'clock in the morning, I look forward to go to work. It's because of this kind of initiatives. Thank you so much. And the diaspora department is there to help you.
Thank you so much for the support. One question, yes?
I'm sorry. We've heard some wonderful presentations. Some of them were truncated. I would have loved to hear what Dr. Ongara has to say, as well as Dr. Nigula.
They will still be around.
Right. The issue I guess I'm asking from both, especially Dr. Ongara, is it seems as if we're not using technology to our advantage as far as collecting data and taking those resources to where they're needed. What is the Ministry of Health and Social Welfare doing as when it comes down to data collection? Because we know that it's very essential in getting those scarce resources at the right place at the right time. And Dr. Nigula seems to have those solutions.
Yeah, thank you very much for that question. Yeah, at the Ministry of Health and Social Welfare in Tanzania, we have a system called Health Management Information System, and we have DHIS as well. So we are using this through the University of Dar es Salaam Computing Center to generate data from the communities, from the health facilities, to the ministry level. So we have the system. The system is there and it's working.
Let me just echo what Dr. Ongara just said a few minutes ago. I think they do have some solutions, but we need to go further than that. We need to